Uitenhage is based on manufacturing generally. Everywhere in South Africa, if you mention the name Uitenhage, those who know a little bit about geography will think Volkswagen South Africa, because that is the single biggest employer, not only in Uitenhage obviously, but probably in the province. But if you count feet on the street and you look at what comes past you here every day, there are a lot of people that are unemployed. We have walk-in populations that come in, and the vast majority of them cannot access our kind of services or any kind of services unless it was provided cost-free to them. I'm Dr. Peter Els. I am the CEO of Uitenhage Mental Health, Uitenhage Mental Health Homes. Uitenhage Mental Health is only one of 2 mental health organizations in our province. So we basically have to cover a wide area. We provide counseling intervention services, which very few organizations do give, and also we don't charge for it. So literally it allows people to walk off the street and access services which might be crucial to them at that point in time. In the residential side, we obviously take full-time care of about 70 residents permanently. They are unique because they vary between 18, which is our youngest, and our oldest, I think, is 76.
My naam is Hubert Havenga. Ek bly die afgelope 2 jaar by Huis en die omstandighede waar ek bly is amper soos wat jy in die private sektor bly, maar dit is die omstandighede is lekker. Die mense word gehelp, hoe kan ek sê, die stimulasie is daar vir die mense wat gestremd is, wat nie hulle self kan help nie.
I'm program facilitator at Uitenhage Mental Health Homes. My main job is rehabilitation and stimulation. I also do other things because we're a small organization, so we can't afford too many staff. So I have lots of other jobs as well that would range from admin to just the daily care of our residents. I love working with people. I love helping people. And you know, it's quite satisfying when you go to the homes and you see someone who was down 5 minutes ago and now they're happier because you're there, you're doing something with them, you're paying attention to them, which lots of them don't really get from their families because some of them don't even have family. We are their family. And that really is satisfying to be there for them. You are their person. So that's, yeah.
The whole idea and the whole structure of our network is a homely environment. We're not an institution. It allows them to naturally just feel a lot more, to use the term loosely, normal, because they already grow up with this whole idea that they are different, they get treated differently, they go to different schools. But I think the important thing is for all people that are part of community organizations to be part of the society they live in. Also, it allows society to understand that this is normal.
So we're going to Natalie House. It's one of our 4 homes where our 70 residents live. We're going to do some stimulation, specifically rock painting, because it's very important for them to keep their minds busy. We have residents with psychosocial disability that's caused by circumstances. We have residents who are intellectually disabled that they were born with. So we've just arrived at Natalie House. I usually first pack everything out, sanitize, before I call everyone. Today we're going to do painting. We try to do different things. So we have things that are physical, and then we have things that are more stimulating to the mind. We want them to improve their finer motor skills. So we want them to be able to draw, use their hands. We want them to be able to run and jump and, you know, the normal physical things that everyone else does, which sometimes they struggle to do because with severe intellectual disability, you also get physical disability quite often. So our aim is to just rehabilitate them, help them become better than what they are right now. We don't want their disability to worsen. So if someone is depressed, we make sure that they are not lying in bed all day, they are not doing nothing. Even if they just sit outside with us, that's enough for us. They need to do something. Do you want to do another one, Diane? Well, with COVID-19, they've coped quite well. Our residents obviously get frustrated and upset when they can't go out, but we try our best to eliminate that by keeping them busy, stimulating them, and that helps them to cope.
Die belangrikste vir dit is met hom social distancing wees. Sosiale afstand moet daar wees en 'n masker dra. Want ons op die oomblik hoef nie maskers dra want ons gaan nie uit. Ons moet net ons mense tussen mekaar. So ons dra nie maskers hier by die huis van sê maar waar ons ander mense kom en wat kom werk by die huis moet ons maskers dra en hulle moet maskers dra.
My concern is the next wave of COVID, not the physical one, but the mental one. Because I think we are sort of slowly seeing the after effects of what COVID physically and medically has done is becoming a emotional and a psychological and a spiritual issue further down the line.
I think our biggest challenges are like funding. It's very limited and that makes it difficult for us and me because I can only do so much. And there's so much more that I can do if I had more finances available. Most people don't know about mental health, and if you tell them mental health, they think this mad person that's going to jump at you, and that's not it. It's not that. And it would be great if the government could actually help us get that out there. Because it needs to dry into the brain. I would wish that more people would be aware of it, and that people wouldn't be so afraid of speaking up about it, and they wouldn't feel so bad and stigmatized, that it isn't such that thing on the sideline. It's actually important that more emphasis is put on it.
What can government do for mental health? I think the realization that mental health is as much an intricate part of human life as physical health, number one. I think if that light bulb moment can happen, and the mental health as a sector, but also mental health generally can be identified as a real essential, not just in words. And we see that happening in finances coming through, in government physically stepping in and saying, right, we want to have the following. It's a huge job. And I don't think people understand just how big mental health is.
Okay, we're going to paint the rocks.
Most of our money comes from government subsidies. The rest we generate through funding that we get through some fundraisers, but also through rent that we charge in our hostels from every resident, and that comes directly into the organization, which obviously is used for services and also obviously to care for those who care for them. In an ideal world where there's plenty of money and we could have enough staff, it would probably take decades to make a dent, to be honest. But I can imagine that we can literally touch people where they are, where mental health becomes something that is spoken about openly, where people are not fearful to say, well, I'm scared or I'm nervous or I've lost somebody and I don't know what to do about it. There's a global campaign to speak your mind about mental health, and I think it is crucial. As I said, I think mental health in its entirety has been successful in ways I don't think we often measure, because it's difficult to measure. Well, just you're sitting there and listening to somebody can make all the difference in the world.
Julle is oulik hoor. Michelle, kyk nou. Hy's mooi.
Is mooi, ja.
Should I? What color do you want? Do you want some of this? Okay, some silver. Okay, so sprinkle it slowly.